All right, parents, here we go again. It's the Ask Dr. Tony episode. This is the Experience Miracles podcast, and I'm your host, Dr. Tony Ebel, an expert in pediatrics, neurodevelopmental disorders, and drug-free, nervous system-focused healthcare. On this weekly episode, I'll be addressing the top questions on every parent's mind. If there's one thing we love and welcome, it's parents who never stop learning, asking the hard questions, and advocating for your kiddos like none other. So get ready for some real talk, real-life clinical and parenting experience, and real easy to understand answers that will help your family take action and get to that next level of health and healing. You ask, I answer. Let's dive into today's episode. So here we go. Welcome to another episode of the Ask Dr. Tony Show. If you're listening in later, I remember when the team and I formed up the plan to get into this once a week and be able to go live, put it on the podcast, put it out everywhere, and just continually answer your questions. We wrote up a little, I don't know, what would you call that? A little promotion for that particular kind of episode and this particular kind of content. And we said we would answer your tough questions. Well, that is the truth with this one. We are going to tackle the question. This is the first version of it that came in a couple of weeks ago, and we get a very similar to same version of this question multiple times per week, not only here on the PX Docs platform, but every day in practice, I get this question, and I go into the answers, the explanations, and the strategies I'm going to give you here. And it says, can I combine my son's ADHD medicine with your treatment? Now, we don't love the word treatment, so we would call that care. We'll dissect that here in this one. Or is it better to have him clean first? I'm reading that one word for word. The first time that this exact kind of question or super similar question came into the platform, that's what it said. Can I combine my son's ADHD medication with your treatment, or better to have him clean first? Now, what does clean mean? Clean means like, hey, should we go ahead and work with our doctor team, work with whoever described it? Unfortunately, with ADHD medications, there's no exam to say, okay, this is the they still rely on the genetic theory and the neurotransmitter imbalance theory. And I've covered that on a full deep dive episode into ADHD about how outdated blaming ADHD, just as one example. So we're going to have the medication conversation period. So seizure families, anxiety families, ADHD families, chronic illness families where your kids are on medications for that. I'm not just having an ADHD medication conversation and answering that question with this one. But when you look at that and they say, okay, it's genetic and it's imbalance in neurotransmitters, and that's why you have to have this medication, to fully answer this question, I would want to get every parent asking it the full scientific explanation of what's really root cause causing their child's condition. So at this point, by the time we're into the thick of doing these episodes and all the content we put out, we have articles and podcast episodes about pretty much every pediatric condition that's out there. So after you listen to this one, if you feel like you still need a little bit of the real deep dive neuroscience into your child's particular condition to have a better understanding about the decision with which is going to be best for your family, for your child, regarding the medication or medications prescribed for that condition, I think you need all the data. I think you need all that information. You need a deep dive into the condition. And then this one is going to do a deep dive into medication and the way with which it works, the side effects that come with it. And then I'm really going to talk about the neuroscience and the neurophysiological realities of what's called drug tolerance or sensitization, which is a hard word to say on a podcast, but it simply means over time, even the positive benefits that may be there in the initial stages, they tend to wear off and kids need to go up on dosages or switch over to new medications because of tolerance and even toxicity that is built up. So we're going to get really far down that road. And then we're also going to directly answer the question, can you do both at the same time? So before I get into my multiple pronged answers, let me get this very important, what would this be? Very important, very real life, awesome, actually, disclaimer out of the way. It is not at all in my scope of practice to prescribe medications, recommend changes to medications. Like nothing in the stratosphere of pharmacological intervention is in the scope of practice of natural health providers, at least mine. I can only speak to me, doctors of chiropractic. And we love that, by the way, because you can't be a jack of all trades. The reason medical doctors are obsessed with medications is pretty much their entire training is all about diagnosis and medication. So it's about chemistry and pharmacology, and they know that world inside now. We spend we have a lot of chemistry training, unfortunately. Big science guy, but cannot stand chemistry. So good thing God made me a chiropractor. But our obsession is neurology and physiology and actual function and root cause science versus just, shoving things down and covering up symptoms with medications. So we're not educated in medications. We're not licensed to speak to medications. But in the same breath, we totally understand that our patients coming to us, drug-free, root cause, nervous system focused family chiropractors, that's one of the goals within the goal. The goal is to get to the root cause. The goal is to get your kids' physiological, neurological function better so that they get to the other side of their struggles and their conditions, which would include, if they're already on them, getting to the other side of medications. Or if you're getting into this kind of care before medications, which is kind of the current landscape of parents is we now know where the medical system, which obviously, as of recording this and going, I'm doing it live and then it becomes a recording, took a big blow here in the last little bit. Thankfully, our kids' health is, even in a big landscape that I also know nothing about, also starts with the letter P, politics. Hopefully things are moving in the right direction, right? That we can actually now have that conversation. Why are we going to drugs first? Why is there a drug for everything, acute, chronic, everything? And why don't they work very well? And why are they all full of side effects? And if we keep taking more medications, which are supposedly going to be the answer to getting us healthy, why do we have the worst health by far, by every measure, chronic illness in kids and families ever? So it is the perfect time to have this conversation because the entire generational shift is happening where we want to put medications last, not first. But what are the truth about medications? One of them, obviously I'm covering right here, is it's not in my scope of practice to say, get on them, get off them, or change them. None of that. No recommendations coming at all about what to do with your child's medications. That is a conversation you've got to have with the doctor or doctors that prescribe those medications. But I can absolutely positively help you tremendously here to be equipped to have a much more effective, thorough, scientifically rooted conversation. And so what I'm here to do is partner up with you. And that's a conversation and that's a decision for you to make with your medical prescribing doctors for your child. But that's a hard conversation to have as a parent with no information. And are you going to get any information over there? Are they going to really talk about the side effects, the toxicity, the tolerance? Are they really going to say, hey, you know what? You could do these different safe, natural alternatives and you could save this for last. Now they throw those out first. But there's also some good things to this. Obviously, my son's life in his emergent crisis situation was saved by medications. So while we're obsessed with nervous system health and drug-free healing as a chiropractor, I just got to tell you, and it's just my walk, it's my path that God has put me down. I actually have significant respect and reverence and understanding of the time, the place, and the potential life-saving intervention that medications are. So there's three things, there's more as we get going, but on my beginning of my list, there's three things I want you to know about medications. Number one, they absolutely can be life-saving when used appropriately. Number two, they absolutely come with side effects. Pretty much, really, all of them, short and long term. And really, number three is true. They can interfere with other healing modalities and mechanisms and care approaches. So coming back to the question that sparked this episode, this content, can medication be combined with chiropractic? And what the mom is kind of saying in that question and all those we get, what you guys are really asking, which is an awesome, ridiculously intelligent, awesome question is, hey, will both work best? Or do I need to make some changes to one to get the new one to work best? And I will answer that multiple times with lots of science in this, but I'll answer it just nuts and bolts first. The way that our care works best is, one, we don't enter conversations that we don't know anything about, okay? So we can have this conversation, but we can't make the recommendations. I just can't say that enough. what we do instead is we focus entirely, especially initially, on the levers we can control. So what we know about a kiddo who is on medication when they start care with us, ADHD, anxiety, epilepsy, whatever it may be, we know that this occurred. Their nervous system and their physiological function got so off track, so dysfunctional, and so out of balance that in what's called pattern or presentation that showed up for that kiddo, it caused the symptoms to be severe enough to get a diagnosis and get a medication. Now, I know you're just listening to my words here, or if you're watching the video, you can kind of see my hands, but there's a sequence to that, right? Step 1, there's neurophysiological dysfunction. Step 2, there's symptoms, signs, issues, problems, challenges that lead to a diagnosis. That is the business of medicine. That's what they do. They aggregate the symptoms and they say, you therefore have this. And then 2 begets 3 in the medical world. Number 3, there's a medication. So really what I'm going to have this whole time on this one too, is I'm going to have a deep dive conversation into number 1. What is the root cause? What is the neurophysiological dysfunction? And when medications work, here's what they're doing. When I say work, we got to kind of finger quote it, meaning temporarily, artificially, from the outside in, they are improving symptoms. In order to improve symptoms, they must alter, manipulate function, physiological, chemical function somehow, right? They do. They're very potent. That's why they have some benefits symptomatically for a short period of time. And they also come with all the side effects because they're quite manipulative, these little suckers, when they get inside the body. So if they artificially, through chemical manipulation, come in and make the symptoms better by degree of measurement, we'll talk about it as we get along, well, then that's where the medical world goes, bam, they worked. That's the benefit. And again, when your child is significantly, severely struggling with things, like my son in the early stages of having seizures and struggling, come on. Thank goodness God gave us these things to get in, fire department, emergency department, and put the fire out and just end some of this severe, significant struggling that might be there. And so that's where you could, in a vacuum, you could say, okay, well, that's the benefit of this medication. We're dealing with this really severe, not good stuff, and we need to address it in that way. And so that's really the first question we always ask parents. So in this conversation, before we go into the deep dive scientific answer, we kind of get a little Socratic and we say, okay, well, let's break this thing down into all of its variables. Number 1, and only parents can answer this, okay? Number 1 question to ask yourself is the medication working? Okay. Are you getting the direct, complete benefits from that medication? And in a net kind of mathematical equation, is that significantly improving quality of life? Okay. So is there a benefit to it? Number 2, what are all the side effects? What are the short-term side effects and what are the potential? And 2A is, what are we dealing with right now? ADHD medications often cause significant appetite suppression, digestive issues. Antibiotics come with destroying the microbiome and weakening the immune system and jacking up the gut-brain connection and those sort of things. So every medication has short and long-term side effects. Most of the seizure medications come with a significant risk of long-term developmental cognitive delays, okay? And all sorts of like Keppra. There's what's called Keppra rage. There can be tons of behavior and agitation and anger, almost OCD-like challenges that come with it. I'm very, very briefly giving you some examples, which are literally in a book as thick and tall as me, of all the different medications that are out there and all the different side effects. So number 2 question to ask is, what side effects right now, readily apparent, are we dealing with from this medication? And then you kind of got to play the long game too in the midst of this decision. What are the long-term benefits? I'll give you a real life example. When Oliver was in crisis, if you don't know about my son, very short of the story, traumatic birth, born early, terrible hypoxic brain injury, physical brain injury to the brainstem, having seizures, cardiopulmonary issues, PPHN, heart-lung bypass surgery, brain damage on MRI and EEG, like the worst of case. So for 2 weeks to put the fire out, just to allow his body to breathe, they did these, literally for him, they did these interventions, ECMO, they did these medications, phenobarbital and other sort of things, because we just needed to, through medical intervention, call timeout and get him to survive. So you can't get healing, you can't get thriving in real tough cases until you get surviving. Well, as soon as that 2 weeks of incredible, life-saving medical miracle intervention was up for Oliver, I was playing both short and long game with our decisions for our child. I can't say that enough in this episode, answering this question. These are the decisions for you to make about your child. So that's why I think it's worth multiple conversations with multiple different types of doctors and multiple hours to days of doing research and understanding what's really going on. Thankfully, I am a doctor of natural root cause nervous system focused healing. So I knew for Oliver that we were going to deploy that drug-free root cause nervous system focused chiropractic and holistic healing in spades. Oliver was going to get the best of, medically they'd call this alternative care. Medication should be called alternative. So I never use that word because that's not the right description, okay? And so we were right in this juncture of saying, thank you. My goodness, there's no way to say thank you enough. They literally saved my baby boy's life, okay? And then they had nothing else. And then they said this, keep him on this drug for 2 years, keep him on this drug for 3 years, and keep him on that one for 3 months. Where's that? And my questions were, why? And where's that number come from? Show me the research, explain the neurophysiological data behind that, like give me the reasoning. Nobody could. And what I knew about the seizure medications, especially, they wanted him to stay on phenobarbital and they wanted to add a medication called Keppra. It is clear as day in the research and with patients I'd already been seeing in my clinic that caused significant long-term cognitive delays. So I'm giving you a long example on this one, but when you look at side effects, you've got to look at the ones that are there now and look at the ones that aren't there yet. Because a lot of these, especially medications for neurological conditions, they really get in the way of cognitive and overall neurodevelopment. And if Oliver was ever going to have a chance of a full, optimal nervous system focused function in life, we needed to get him off the medications, and we pushed hard. Did we get pushed back? No way at all that I have words to describe to you how difficult this was for us to navigate. And I know my stuff. So if I haven't said it yet, if this hasn't come across, my empathy, my relatability, my compassion for you all in this space and asking this question, that's why, this would be a real easy one for a chiropractor to skip over. On my Google sheet my team sends me where these questions come up, it's a lot easier for me to answer other questions. It's when I get into a medication conversation, I'm right on the fence, right? I have to kind of go right up to the line of my scope of practice and everything. And I will be very clear throughout this whole one as to not cross that line. But as a parent, I was making a decision from a different standpoint, right? I had the provider training, the neurophysiological advanced training and understanding, but I also had my parent hat. And so for you, I just want to triple tap on that and say, your child, your family's health. And so you keep moving down this road until you get to go down the road with the results that you want for your kiddo. And just don't forget about the potential long-term side effects. You have to factor that in. And then number 3 question in this process, kind of question within the question. So I know I'm answering a question by first getting you to understand the context. And then second, to get the answer to this question along with us, let's say you're working through this with your PX doctor and I'm kind of, filling the shoes for that right here. And you're working with your medical doctors in order to really come to the best answer and the best path and plan forward. You've got to answer these questions. So that's why I'm turning this around a little bit and saying, okay, let's go through as parents and ask these questions. Number 1, is it working? Are we getting the direct benefits we want and improvement in quality of life? Number 2, what are the side effects, short-term, long-term? Number 3, if we do want to go forward and make changes, so this is parent, not me, and want to wean off or change or lessen medications, will our doctor and pharmacist help us do this safely? Now, obviously, the first doctor, the first pharmacist, the first medical providers you're going to talk to about this conversation are the ones that prescribed it. But remember, and I could just say this very succinctly and short, there's other doctors, there's other neurologists, there's other psychiatrists, there's other epileptologists, there's other pediatricians, there's other nurse practitioners, there's others of whoever prescribed you this medication. I'll say it for the whatever number of time. This is your child. and your family's health. And what this platform stands for forever is, you bet, all the neurophysiological explanations. I'm about to let loose on the science of this here in a second, but this stuff matters most first before the science. Your child. We are always going to educate and inform you scientifically so we can empower you, and so that you can know that the decisions made for my child's health and well-being are up to me. It's up to us. And doctors, no matter their initials, no matter their experience, no matter whether they recommend medication for a treatment or nervous system focused chiropractic care, not treatment, not a cure, not treatment at all, and holistic healing, they work for you. And the way they work best for you is they work with you in an empowered, informed, open communication partnership. That might just be my foremost obsession with my practice, is to never be a dictator, never tell my patients, you have to do it this way. If you don't, you're out. Like, if you want a sign that pediatricians, conventional pediatricians, do not have the best interest of their patients in mind, then why would they kick ones out whose parents want to take a path that is more natural and more safe? That right there exposes the whole truth as to the operational mechanism with which doctors like that, which obviously isn't all of them, get from. So if you get pushed back as you look to push forward to get your kiddo, again, your child, I can't say that enough, down this road, well, find another one. Find a second opinion, find a third opinion, find a more experienced, natural, holistic, integrative, functional expert to join your team, because any doctor, and again, this is an absolute conversation. That it's my hardest job is on this content, because I'm answering questions that are coming from individual kids and individual families, but I don't get to dive into their individual case, have all the details, and be the actual doctor on that team. So I have to kind of go from an individual question to a generalized answer. But I just want you to know that this stuff we've covered on the first half here of this Ask Dr. Tony episode, those are key components of understanding. Those are key questions to ask yourself. And let's come back once again, because I realized I went from that to the questions and I didn't close the loop. Can nervous system focused chiropractic, and I'm actually just going to lump everything together. Can things natural, things holistic, things that are drug-free, things that are going after the root cause, can we see results for kids? ADHD, anxiety, autism, can their nervous system heal? Can they actually restore function and get better with quality of life, even while still on medication? The answer is yes. It is absolutely not required to start chiropractic care, especially to, as that mom, I just loved the word, go clean. You don't have to go clean first, but there's something coming before we get done with this conversation altogether, where there's a moment in time where, a moment in the care plan, we would call it, where we're restoring neurological function. We're getting the nervous system and the physiological system to heal naturally, neurologically on its own through adjustments and through the care and through the things that we do. And then there becomes this kind of fork in the road, or what I always I train this to our doctors. I always say, this is the critical juncture in the care plan where you can look at it not from hey, it's in our scope of practice, not the perspective we're taking right here, but we can look at it from a neurophysiological clinical results perspective, which is we're measuring the kids' what are called neurological soft signs and the stages of healing. I just did a full deep dive episode on that. You got to listen to that one. That'll really explain it down. And then we use our scans. We actually measure not just symptoms. We don't just ask, hey, how's your kid doing? That's part of it. Are we making changes? But what matters most is we measure actual neurophysiological function, and there'll be this critical juncture, this kind of fork in the road as chiropractic care, this kind, nervous system focused, neurological restoration chiropractic care, as we're moving forward and we're seeing function restored and we're seeing what are called neurological soft signs. A child is sleeping better. A child's digestion is improved. A child's respiration and immune system is improved. A child's gross motor, tone, coordination, movement, gait, symmetry, sensory processing, sensory motor function is improved. There's this whole list of early, subtle, wonderfully important neurophysiological signs of healing. Often, if medication remains in that child's system at that juncture, at that fork in the road, and after, you get this rock in a hard place. healing gets stuck. There's only so far that the neurophysiological system can heal on its own when there is an outside chemical medication continuing to come in each and every day and getting in the way. So this is not always an exact, perfect, easy to see the forest through the trees science. But with our clinical experience, it's why I did choose to answer this one. With being in practice for almost 20 years, and in my early stages, 80% of my patients starting care already on medication. And now today, still many of them doing this. There's definitely this fork in the road. And we can see it from the improvements that kids are making. So we track this very closely. And we can see it on the inside scans as neurophysiological function starts to improve and restore and look better and be better. And then if we start to reach this plateau point, if we start to reach this stuck point, that gives us really great clinical data and evidence that that's the time that we highly encourage. So this is where in practice, this is the moment during the care plan. This is the moment in time that I would sit down and proactively, in case they haven't asked it yet, usually they already have, but I would sit down knee to knee with parents and I would proactively explain everything I'm explaining on this one right here. And then I would finish that explanation with this science, the neuroscience reality of medications, which is first, what I'm saying there is they do over time become a roadblock. They can over time become a hindrance to full and complete healing when you're working from a natural, drug-free neurophysiological approach, okay? In the initial stages, even if I could, which I can't, remember, the full important disclaimer, we do not, cannot, will not even pretend to recommend up, down, left, right, little Nintendo reference there, medications. But if I was just playing this out, if it was in my scope of practice, I wouldn't change them in the initial stages of care. Now take it in a vacuum. If that soundbite comes out and goes around in chiropractic land, they're going to be like, huh, you love medications? No, bro, chill. In the big landscape, what it is when you go to actually get a kid better, and I've covered this on so many different types of content on this platform, you can't do 17 things at once. In fact, we are so meticulous. We are so dialed in with our clinical care approach. One of the things that makes us very different, even in the natural health world, most people are, they sit down, you go to see a functional doc or a functional med or a functional neurologist, which are all different than us, did a whole episode about that too. And they say, we know exactly what to do to get your kid better. I need you to do these 173 things starting tomorrow forever. And that's not how the nervous system heals. That's not how your child heals. They have to heal in sequence. There has to be a foundational first step, and that's getting the nervous system function restored. So even in a case where a child is, and actually this is the same, it's the same conversation, medication versus supplementation versus therapies. It's very rare, even on the stuff that I can recommend, and I can within my scope of practice say up, down, left, right, supplementation, herbs, homeopathics, other therapies. Like as a licensed doctor, we can definitely get into those conversations, just not the medication one. Thankfully, I'm actually glad I can't. And we, even in those cases, I don't say, hey, stop doing this. We always start care and we go through the initial phases, adding chiropractic alone. Now, then that's where this junction shows up and it says, okay, are we now up against it? Are we now at this stage of healing where we're going to get stuck and we're going to spin our tires if the medication remains? And that's where we enter this conversation or we answer this question for parents and we say, hey, let me get you this data. Let me get you this information. And then you go talk to your doctors. You go work with the doctors that are already there. And if they won't work with you and you still want to go down this road, again, up to you parents, then let's, and we have a lot of doctors who are very, very, very pro root cause natural healing and are medical doctors. So they have the ability to help families with this in a bigger way. So we say, okay, let's find you a second opinion or a third opinion. Okay, last chapter of answering this question about medication and how it works with chiropractic and things holistic and natural. You got to know about this stuff. Get ready for some nerdy stuff. I won't belabor the point too much, but this is some cool stuff that I'll bring through my Iowa farmer lens so it makes sense to you. There's absolutely a phenomenon. It's a real neurophysiological reality that medications lose their effectiveness over time and cause increased side effects known as tolerance or drug sensitization. And really, that's what I kind of call that medical roadblock. It's almost kind of just a emotional, clinical, life reality roadblock for families and us as providers where we go, okay, we got to have this conversation. We don't get past this roadblock. we don't get this kid all the way better. And so what's actually happening within those physiological mechanisms? Number one, these are, and I'm a nerd, so I'm going to say these words here out loud, and parents are going to be like, what the heck did he just say? But this is so fun for me to nerd out like this, okay? I'm much more comfortable in the sciences than the, I don't know, emotional conversations, okay? And I'm also a dude. So, how much do I really use my emotions? Very little, okay? Unless it helps the kid's life get better. All right. So pharmacokinetic tolerance. This is where over time, so the kinetic means dynamic, okay? And pharmaco is the drug. What happens is the body actually gets more efficient at metabolizing and eliminating the drug. So that is where the liver enzymes and other metabolic factors. So if your child's been on medications, hopefully, especially for any period of time, hopefully they're checking things like liver enzyme and kidney function, because many medications really wreak havoc in those important parts of the body. So the body's intelligent. The body is smart. And if every single day that medication is coming in, the body's going to respond. The pieces and parts of the body are going to respond. And sometimes they will increase the efficiency of the metabolism, which is going to alter the effects from the same dosage. Number two, you have what's called pharmacodynamic tolerance. This is where the receptor, and this kind of getting into the physiology real deep, the receptor, kind of the downregulation factor of this, the body will go, man, if you're going to keep pouring this in here, I'm going to actually downregulate and suppress the receptors. And what happens as the drug continually stimulates these certain receptors, the body responds by reducing its numbers or actually their responsiveness, which diminishes the drug's effect. Now, this happens on pretty much all of them. This happens across, by the way, we're talking about it from medication, but this happens with, food and alcohol. And unfortunately, right? Like you have to increase the dosage because the body downregulates intelligently, by the way, beautifully, by the way. This is actually a sign of the body's intelligence to respond to toxicity, that it downregulates these things, okay? So it's adaptation. And that's what's going on. The third thing here on my notes, as I wrote it down, is called physiological adaptation. The first two things happening are real-life examples with medications of physiological adaptation. But the truth is, the body might counteract. The body might go, hey, you're going to come in here and do this. I don't want that. So I'm going to do this instead. Bam, side effects, okay? So now you have this counter adaptation, and that's where the side effects come from. Anyway, I can't believe I haven't said this whole episode and not stated how I see it. What a crapshoot to call them side effects. Like when you see the commercials, which again, maybe, as of recording this, maybe hopefully one day soon, we won't be able to have commercials on TV. So we can just watch football, which is the only time when you watch live sports, the only time anybody watches commercials, because everything's now Netflix and whatever else streamed. But the truth is, it's just criminal that we can literally sell drugs directly to the public. Here's all the symptoms, and then you're gonna have a better life. And then they say the side effects. How do they get away with calling them side effects? People don't have those effects. Kids are not gonna have those effects, those negative, unwanted, quality of life disrupting effects if they don't take the medication. It's not a side effect. That is a misnomer. It's a cute little term they get away with to say direct effects. Or if you want to be a little bit physiological accurate, they are indirect direct effects. Like your kid wouldn't have these challenges if they didn't have the medication. And so then also there's just behavioral tolerance. We see this all the time with teenagers with anxiety and ADHD, where they're like, hey, I'm just going to, because we have that incredible capacity of cognitive understanding and control, even especially older kids, then obviously that becomes more pronounced. And there's behavior tolerance as well. Okay. So what's happening? Why does the drug, that kind of covers why the drug over time becomes less effective. That covers why the side effects may continue, are there in the first place and may get worse. But let's talk about why they may really get less effective over time and even more side effects. Drug accumulation. This one stinks, but it's real. These medications, especially because you got to remember the body already has neurophysiological dysfunction to cause the signs and symptoms, to get the diagnosis, to get the medication. So if you really unwind all this, there's deep-rooted neurophysiological, bodily, biological dysfunction within the body that would have ever first put in play the need for medication. So now the medication is going into an already dysfunctional neurophysiological system, and a lot of those medications get stuck. the body can't detox from them. They get stuck in certain tissues, they get stuck in certain organ systems, and they really have long-term effects due to drug accumulation. As we already covered before, that altered drug metabolism, now when the body has to metabolize these medications, it creates metabolites. So it creates these little offshoots, right? It creates, if you're chopping up, a weird analogy, but it just came in my head because my kids love strawberries. We eat very healthy around here. So the amount of time I spend chopping up strawberries in the morning, my wife and I, it's a lot. How have we not figured out to just have an auto strawberry chopper machine in our kitchen? If somebody knows of one, please, I could get so much more done with my life. But when you get done chopping off the stem of the strawberry, that there's leftover, right? Now, in this analogy, that's a really crappy analogy because that's actually still healthy. And then we take it out to the chickens and the chickens eat it. And then we have the chicken eggs. So we have very healthy chicken eggs too, because all of our fruit metabolites, I just got to run this one out now. I'm already in the thick of it. So there's metabolites to it. The third thing that happens is there's immune system sensitization. So the immune system gets completely dysregulated from medications. And then there's receptor changes as well. All right. Goodness gracious. What a classic Dr. Tony answer of nerdy neurophysiological proportions, right? Let me come back and recap this thing for you. All right. Number one, when you look at the question that was directly asked of us, do I need to have my kiddo off medications before starting chiropractic care? Let me actually add some things. Do they need to stop taking all their supplements homeopathic and do it? No. In fact, if we change too many things all at once, and good stuff happens. This is how I say it. If we change a bunch of variables all at once and we have good, awesome changes, we hit the goals. We don't know which did it. We can't really pin the tail on the donkey and go, that is what's working for your kiddo, so let's do more of that. We need to know the good, and we also need to know the bad. If we're changing too many things at once and we get unwanted effects, we don't know which one to pull off of. So what we tell our families all the time is change nothing. Okay, don't change anything in the first, and the time equation on this is different depending upon the case. Maybe that's only a week, and then if it's an intensive, we're adjusting twice a day. So we will then recommend a time frame with which we leave everything else the same because we're going to add chiropractic nervous system healing into it. So this is one of the biggest things, one of my biggest kind of pet peeves, and I really get frustrated with it because I did it myself, so I know how less effective it is than doing things in a specific sequence over time, one thing at a time, and that less is more. But even in the natural health, if we add 7 things, 3 things, 17 things all at once, we don't know what's working good, and we don't know what might be creating not good either, okay? So you do not, to directly answer the question, moms and dads out there, you do not need to wait to start chiropractic care until after your kiddo is clean, as the first question came in, or off of medications. In fact, here's my final thing with this. If that's your goal, okay, and I realize now this part right here, lean in with me, everybody. If this is important. I should have said this in the front and the middle. If that's your goal, goodness gracious, do you want nervous system focused chiropractic and root cause, holistic, natural healing in your life? Because one, you've got to actually repair and restore the neurophysiological function to the body to get everything better, to then have a chance to say, hey, we're better to the medical doctor, to the neurologist when you go have that conversation. We're actually better. Let's make some moves. Life is better. The condition, the symptoms are better. We don't measure our care working because the symptoms are better. We measure our care working because the function is better. But they tend to go hand in hand, right? So you get exactly what you want, which is we look at nervous system function getting better, and then your child's life is getting better, which makes it a whole lot easier in those scenarios to go to the medical side and say, let's make some changes here, okay? So you need to first restore function to get to the other side of medication in the first place. So this is absolutely where you want to start, even if your child is already on medication. But there's more good news. We're at the end of the episode here, but there's more. It's not easy for a physiological system to come off of a medication. There's withdrawal effects. And we talked about all the bumps on the road when on the medication. For a lot of them, especially epilepsy, ADHD, and neuroactive medications, coming off of them is a very, very, very bumpy road full of withdrawal, kickbacks, and all sorts of challenges there. Well known, not a chiropractic thing to say that. That is clinically, scientifically, even pharmacologically proven. We know that. So if that road is bumpy and challenging, what would make it smoother and easier? Having restored just healthier, more functional physiological and neurological function. So when a family, because it's your choice, your child, your decision, when a family in conjunction with their medical doctors, not with us because we can't, make changes to the medications, they're lessening them, they're coming off of them, they're titrating them, and they're moving forward to a drug-free outcome, it's very important that we know that as that child or that patient's nervous system focused family chiropractor, because we know that the withdrawal effect of a medication is going to add stress to the body for a short season. Very important, very awesome. Let's go. Let's get it done short season. But because that withdrawal effect is going to add stress to the body, we need to fight fire with calm. And so we add more adjustments. So when our kiddos are, or our patients are, and their families come in and their doctors are green lighting and working with them in partnership and saying, hey, we're going to titrate off this one. We're going to get off Keppra. We're going to get off Ritalin. We're going to get off whatever. We're going to get to the other side. We will actually increase the chiropractic care. Usually that's done. Doesn't mean we adjust more in terms of a physical sense. It means we adjust more often so that we can offset the withdrawal effects. And so Oliver did have 2 withdrawal seizures coming off of the medication. So I adjusted him 3 to 4 times on those bumpy days instead of 1 to 2 times, which was kind of his regular dosage during that season. So parents, in summary, if this is the path you want to go, absolutely, you must talk to your nervous system focused PX doctor about this because they can help. Everything I just explained, they should know that science. They should go through that, okay? And be able to have that. What they can do, won't do, is step into the actual conversation and make any recommendations. Not in our scope of practice. What we will do is explain all the neurophysiology. We will up the care plan and make sure that we are doing our job to continue to support healing and smooth the withdrawal process, which is so awesome and so wonderful. And it makes it so much more, it just makes it better in such a big way to have chiropractic on your team when you're making these changes in medication. But obviously you got to go talk to the medical team and make that happen. So tough one, dicey one, not, what does the Google Sheet have right now? Where are we at? This sheet has 300 plus questions that have come in to the platform over since we've been rocking Instagram and the podcast. And I don't know, that one probably is right up there with the toughest one to answer. Number one, just to get you all the science in a way that makes sense. And then number 2, get you to the strategies that are effective because it's not a real smooth, easy, lots of people talk about this road. It's a heck of a blueprint to make this move for your kid and your family. And then number 3, a wee bit of a difficult conversation for me so that I can walk right up to the appropriate line where my training and my scope of practice takes me and where I can be most effective and most helpful for your family. Thank you for tuning in to today's episode. Do you have a question that you would like to submit? Either send it to support@pxdocs.com with the subject Ask Dr. Tony or head on over to our socials @PXDocs where you can submit your question in our stories every single week. Every kid counts and every family counts, so let's leave no questions left unanswered. If you loved this episode and you want to help us reach more kids, we would so appreciate if you left a review and a rating on your favorite platform. God bless, be well. We'll see you on the next one.